Hello, good evening. Assalamu alaikum. How are you guys? I hope I'm audible. Yeah. So, how are you, Afreen, Anam, Anamika, Denise, Alai, Amber, Nabila, Amara, Sidra, Fatima, and another Fatima, Hashim, Hussam, Indu, and one iPhone, Lubna, and everyone. I hope you guys are doing good. Yeah. Hi, Shataj. How are you? Walaikum assalam, Jasmine. Thank you so much. I'm good. Good evening. Sonia, very good. Very good. Alhamdulillah. Alhamdulillah. I'm good. Thank you. Thank you. So that's good. So, how are you guys doing? And how's everything at your end? Hmm? Okay. Hi, how are you, Mina, Michelle, Nisha, OnePlus, Sandaleen, Kuratulan, and everyone? Okay, that's good. That's good. Okay, very good, Denise. Thank you. Okay, very good. So again, we are meeting for MRCOG part 2. Inshallah, it will be good, Lubna. It will be good. Okay. So don't be upset about anything. Inshallah, everything is going to be good. Yeah, Shmaila, how are you? Okay. A new ploidy is a new change. Oh, that's my girl. Thank you. See, a new ploidy, a new change. So I always, teach like this. You know me. Thank you. Thank you, Afrain, for remembering that. So very good, very good. So we are going to start our session with the good spirit and with the good note that, of course, we are going to start our part 2 journey. Sometimes it can be very overwhelming. Sometimes it can be exhausting. Sometimes it is going to be the bad as well in terms of the syllabus, in terms of preparation, in terms of everything. But so and so, if you are in this journey, of course you have to sail through this journey, right? So part 2 is a bridge. All right, part 2 is a bridge. You have to cross this bridge. Part 1 is easy, then you have to climb on part 2, which is going to be a bridge, and then if you pass that, then you can go towards part 3, and then you can become MRCOG, isn't it? So of course, bridge is always hard to cross, isn't it? That's a life, the rule, isn't it? So take it as a challenge. Okay, don't always think that it is difficult. I think we all doctors are prone to face all these exams throughout our whole life, isn't it? So one or the other exam, your country board exam, your country, I don't know, specialization exam, and even the our the graduation as well, isn't it? So many exams. So I will give you this suggestion that take this exam as another exam as well. All right. So don't take this exam or syllabus on your nerves, on your head that this is difficult, because I'm sure you must be, the reading, or you must be hearing this thing that part 2 is tough. Yeah, it is tough. Okay. So what? Every exam is tough. So what? Hmm? So if you are going to just think like this, that okay, huge syllabus, tough exam, so what? So it means that you are not going to give this exam? Yes or no? Of course, yes. Because if you are in this MRCOG business, so what is your aim? What is your goal? Your aim or your goal is to become MRCOG by the end of the day, isn't it? So why not give your 100%? Why not give your best and go for this exam? Isn't it? Take it as another exam. All right. So don't take this exam on your nerves that okay, syllabus is huge or blah blah blah. Yes, syllabus is going to be huge. Syllabus is not going to change. Part 2 is huge in terms of the preparation, in terms of the syllabus. But yet again, what you need to bring your smart, the study smart plan. Every exam, I'm sure you all know that that is the kind of strategy. I'm sure for all exam, every exam has something or few things which are must to do. Okay, 100% you have to do them, and then there are things which can be done or cannot be done, and then there are things which can be left, isn't it? So likewise for this exam as well, you need a very smart plan, you need a very focused study. Okay, and of course you have to put your 100% into it. So
वारिस
nothing is going to
ये
come,
देखना इधर
nothing
हेडफोन
is
है.
going to be, the for you, and it is not going to come like this only. All right. So you have to study. So with this positive note that you are going to start your journey, and the revise it, or you can say that the you have to say it aloud to yourself that you have to study, you have to stay focused, you have to stay calm, and you just have to study. All right. So I mean, MRCOG is not a piece of cake. In fact, because I have been through countless exam, so now I have come to a conclusion. Any exam, doesn't matter. Okay, not the single exam is a piece of cake. You have to put your 100% into it. All right, so it's not going to come like this, that okay, I just want to go for this exam, so I'm going to get this the degree just like this. No. All right, so please stay the positive. And if your start is lousy, the things are going to be bad. If your start is smart and start is good, things are going to be easy for you as well. All right, so all the time you have to have a positive approach. All the time you have to have a very, the calm attitude towards your syllabus and all. All right. And today I am going to give you an overview about, the how to start preparation, the for MRCOG part 2, and then how to pass MRCOG part 2. All right. So I'm sure many of you guys know me from, I don't know, from social media, I must say. So this is me. Actually, I was at somewhere, I just, came home and I have just started my computer and I'm in front of you. Otherwise, I would have, started my video. So, all right, this is me. This is me, Dr. Zaib Qureshi. I am from Pakistan. I have done FCPS from Pakistan, then MRCOG from UK, then MRCPI Ireland, then another board, which is, the European Fellow. I'm European Fellow as well. All right. So you can see that, so many exams, of course, then so many hurdles as well. So what? By the end of the day, I'm in front of you. Okay. So I've been a student like you guys. I have failed, the one or two exam as well. But it doesn't mean that I was a bad student. Maybe it was not my day. Okay. Maybe it was not meant for me. Okay. Maybe I made mistake. And yes, later when I sat with myself, I realized that yes, 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 I did some mistakes and it has costed me. Right. So by the end of the day, my dear, all you need to think of that you have to become a MRCOG. All right. So aim big, dream big, and work for it. And you can have everything, whichever you want for yourself. All right. So let's get started and let's have an overview about MRCOG part 2. I'm sure many of you already know about, the part 2, what exactly part 2 is, how to go about it. But of course, I am going to give you a complete insight about, the exam, its syllabus, how to start, what to focus, what not to focus. Okay. What is this? All of you. Anybody has any idea about it? What this building is? This is Royal College building. All right. This is Royal College Union Street building. Okay. College has been transferred to this building in 2022. Earlier, this was the building. It was in front of Regent Park, very, the glorious, very famous, back in till 2019, till, the COVID hit the world. Okay. This used to be a favorite place for every candidate. Whoever goes to, the London, they used to go there and they used to take a picture and make their, the profile picture, okay, on WhatsApp, Telegram, and blah, blah, blah. So it was a very glorious, the building. And then now college has been shifted to Union Street. All right. So, think about that one day I am going to be standing in front of this building. Okay. I'll be taking picture over here and I will be attending convocation or graduation ceremony. Isn't it good? Hmm? So, my dear all, if I can do it, you can also do it. Okay. So take it as an other exam. Don't take this exam on your nerves. All right. So write it down with yourself, revise it every day, and just, you are going to do good. All right. So please mark my words. If I can do it, you can also do it. Okay. Inshallah. So things are going to be easy only if you have a positive approach towards that. All right. Otherwise, everything is difficult. Nobody was teacher, nobody was master when they started off. All right. So what did I learn through my whole journey? That you have to put your extra effort and hard work. All right. So I have a beautiful picture in front of this building as well, because when I attended my convocation in UK, okay, so it was this building and then college was shifted to that building. And now my another dream is that I have to go to that college, maybe as an examiner or something. And then I have to take my picture as well. See, dream big, aim big, and then go for it. Who is stopping you? Nobody, only you. All right. If you are having this fear that I am not going to achieve it, trust me, you are not going to achieve that. So have a positive approach. All right. So from now onwards, don't say that syllabus is huge. Don't say that this is a tough exam. Don't say that this is going to be a bad or something like that. Doesn't matter. So what? It's a syllabus. Syllabus is not going to change this way or that way. You have to study. All right. So tough, what tough? I have been through countless exams, so I know. what exam is. All right. So have a positive approach and go for it. All right. So this is something, I love to, the recite, or you can say the read. This is a kind of champion's creed. All right. So it says that, this is, the simple thing in this, that life's battle don't always go to the stronger or the faster man. But sooner or later, the man who wins is the one who thinks he can. Beautiful, isn't it? So, what do you want for yourself? I want to do it. I want to become MRCOG, isn't it? Then why wait? Give you 100%. All right, start over. Take a fresh start. All right, take a good start. Don't think lousy, don't act lousy. All right. So, if you are going to be slow, if you are going to be lousy, things are not going to be good. Part two is dynamic. Okay, MRCOG overall is very dynamic. And another thing, you have to compete brains all around the globe in almost all parts. All right. So it's not a single exam in which you have to compete your fellow colleague from your own country, because every country has different, the criteria for every exam, isn't it? So now you have to compete somebody who is in, somewhere else around, the globe, and I have to compete with her or him, isn't it? So please don't take anything on your nerves or, the heart or anything, just think this is another exam. All right. So if you will have this approach, things are going to be very easy. So now I'm going to be talking about the curriculum, how to prepare, general strategies to prepare, and then later on I'll be talking about that how we are going to deal the candidates or the students who are enrolled with us in this course. All right. So hang in there. So curriculum. Basically, curriculum is divided into almost 18 modules according to the RCOG website. All right. But most of the time, what happens is that one or two modules are going to be together. And then overall, we are going to have almost 12 to 14 modules. All right. So this part two, part one was basic, in which you have to study almost, the whole basics of obstetrics and gynecology. Okay, starting from anatomy towards biostatistics, or the biochemistry, endocrinology, pathology, or whatsoever. Now you are going to study smartly, and now you will bring your clinical knowledge as well, because you are going to study now guidelines, real life patients, real life, the scenarios, and then you are going to apply the same study, okay, towards your real life scenarios. If you will have approach like this, trust me, you are going to learn a lot and you will love this part too. Because if your basics are strong, if your base is strong, in fact, okay, because the same part 2 study is going to work for your part 3 as well, because the same modules are going to be in your part 3. So you can see that now this is going to be little bit, tough call in terms of the same study is going to work in your part 3. So if I talk about clinical skills, teaching, appraisal, and assessment, the general, the concept, how NHS works, okay? NHS, which is a hospital system for, the UK. All right. So here we are going to study that if we are going to be in a training process, how things are going to work. Information technology. So altogether, these three are going to be in one module: clinical governance and research. We have been doing research, okay, throughout. I'm sure the candidates who are in Pakistan, so we do research for FCPS, okay, we do research for some other, the things as well. All right. And I'm not aware of, the other countries, but this is what I know, that yes, we have to write some papers, we have to write thesis or something, dissertation or thesis, isn't it? So this is going to be something like that. Then now comes core surgical skills. Core surgical skills are going to cover basic aspect, knowledge about sutures, knowledge about, the incisions, knowledge about, the different procedures, laparoscopy, laparotomy, hysterectomy, cesarean section, how many types of, the incisions for cesarean section, which one is good, which one is bad, which one is, the involving which thing. Then, of course, if we are doing any operation, so of course, we need to talk about post-operative care. So this is going to be almost one module. So in post-operative care, we are going to study something which is going to involve almost all these basic general surgical procedures for obstetrics and gynecology. Surgical procedures, yeah. Now comes bulk of this exam: antenatal care and maternal medicine. Very interesting, isn't it? Antenatal care is going to be how woman is going to be in throughout her pregnancy. When is she going to be booked? What are going to be her basic tests? And how we are going to take, the particular antenatal care for one particular disease. And if I talk about maternal medicine, so of course we need to talk about, so many countless diseases, because we are talking about medicine. Yeah. So medicine is so much exhaustive. Okay, some of the disorders are going to be very, very important, which we see on daily basis. Now you guys have to tell me, which type of maternal medicine disorders do you see in your hospitals or in your clinics or in your OPDs? Any case? And how do you feel yourself, that how do you treat, according to which guideline, according to which protocol, or according to what type of medical disorders do you see in your daily practice? Yeah,
Like
anyone?
cardiac diseases in pregnancy,
Exactly.
hypertensive disorders,
Very good.
diabetes mellitus,
Yeah,
anemia.
yeah, yeah,
And
yeah.
we
Very good.
usually follow the nice guidelines.
Very good. SLE, yeah. Anemia,
Yeah.
preeclampsia, yeah. Very
GDM,
good. Yeah, GDM, or the jaundice, yeah.
hypothyroidism,
Diabetes, yeah.
yes.
We do see hypohyperthyroidism, isn't it? We do see
Yeah.
obscolistasis. We do see acute fatty liver of pregnancy. Yeah. We do see
Mm.
sickle cell disease. We do see thalassemia. We do see hemophilia. We do see von Willebrand disease as well, isn't it? So this
Infections,
infections, chickenpox, varicella.
hepatitis,
We do see, the herpes. Yeah. So many
good.
diseases. So almost all diseases will be covered in this module. So can you see that so many epilepsy? Yes, Sabah, thank you. Very common disorder. Hmm? All these are going to be covered in maternal medicine. So can you see this is going to be very interesting? If you will think of that, yeah, I have seen one patient with epilepsy the other day, and my consultant or my professor has they given this. Okay, let me check through guideline that was it good? Asthma, yeah, asthma, of course. Hmm? So this is how you are going to apply your guidelines into your clinical practice. And trust me, personally, I love maternal medicine. Candidates who know me, they know that I literally love maternal medicine. And this is my favorite, the module out of the whole curriculum. Of course, I love other too, but this is my, the kind of cardiac disorders. Yeah, palpitation and arrhythmia, valvular diseases. We do see rheumatic heart diseases. We do see rheumatic fever. We do see, the other cardiac valvular diseases as well. How to manage them in pregnancy. This is what your antenatal care and maternal medicine module is. So sometimes it is going to be only one module. Sometimes they are going to be blended. But mark my words, this is going to be the bulk of your exam. Mhm. The same, for example, if you take asthma woman, if you take epilepsy woman, so of course, if she is going to go through 9 months of pregnancy, she is going to deliver. So you are going to study the same general mechanism of labor and delivery, and then you are going to study that what type of special precautions to be taken from any maternal medicine disorder. Mhm. So you can see that one module is going to be linked to the other module. But of course, you have to study certain guidelines first. So we are going to cover plenty of guidelines. So that's why it looks very exhaustive, because we do have a lot of guidelines, a lot of syllabus. Then of course, if somebody has delivered, okay, so postpartum problems, puerperam, postpartum care. Yeah. So this is going to be obstetrics. Then comes gynecological problems. Now tell me, guys, what type of gynecological problems do you see in your day-to-day practice? Anyone?
Menstrual problems,
Yeah, menstrual disorders,
malic
HMB. Yes.
gynecological malignancies.
Infertility.
Oh yeah, so fertility is going to be there, but somehow gynecological, polycystic ovarian syndrome. Yeah, we do see
Yes.
menopause. We do see premature ovarian failure. Yeah, we do see sexually
Fibroids,
shared infection,
prolapse.
fibroid, prolapse. We do see a couple of so many. Well, so do you
Mm.
see that if you will study this, this is going to work in your the clinical practice as well. So isn't it going to be interesting if you will study? So trust me,
Mm.
like how I study for myself. When I started off my study for this part two, I used to study. Oh yeah, I have seen one patient with this. So now let's check what is written in guideline and then how we have to treat her. So I'm sure this is a practice for almost all training, the curriculums in, I think almost all around the globe, that we do follow certain guidelines. So of course, if we have some kind of ambiguity in management, even if some, the certain patients are admitted with us, so we open guidelines there and then, and we do try to treat, isn't it? So likewise, gynecological problems of fertility, then sexual and reproductive health. In this, we are going to study some sexually shared infections, some, we are going to study, the sexual, the related guidelines, contraception. Okay. Then
Right.
comes early pregnancy care. What type of early pregnancy problems do you see on daily basis?
Ectopic abortions, hereditary
Exactly.
from all.
Ectopic, miscarriages, molar pregnancy, nausea, vomiting, pregnancy. Then we do OHSS. Hmm? Exactly. See, so this is going to be covered in this. Don't you see? It is very interesting. Yeah. Then we do see oncology. In oncology, we do study almost all the cases of cancers. Hmm? Carcinoma ovary and fallopian tube, carcinoma uterus or endometrium, carcinoma, the vagina, carcinoma cervix, carcinoma, the vulva. See, urogynecology and pelvic floor problems. Yeah, another interesting modules. So we do study incontinence. Yeah. We do study stress incontinence. We do study overactive bladder. We do study, the mixed incontinence. So we do study the basic. Okay. So clear about modules. So almost these are going to be 18 modules, but altogether, if you combine them, because certain modules are going to overlap, so they are going to be almost 12 to 14 modules only. Hmm? So what does it, the look? What is the outlook? Do you find the whole curriculum or syllabus, the interesting or no? Hmm? Generally, I'm asking. Don't think about, the topics. Generally, is it interesting? Isn't it?
It is.
Interesting. Yeah, isn't it? So, what's the stopping you to not to study? Yeah. So please put your 100%, take interest, correlate. It is going to be very good, trust me. you know Life is going to be very, the good and challenging at the same time. Don't you think that when we see something or very interesting case in the hospital, when we come back, we do try to open, we do try to discuss, you know with our fellow colleagues, with our peers, and we do try to find out, the reason that why this has happened. So this is what we call as brainstorming, or this is what we call it as, this is how we are going to apply the same knowledge. Now see, feel the difference. Part one was very basic. What is in our body? What comprises obstetrics and gynecology? What is pelvis? What is blah, blah, blah? Okay, the general concept. Now you are moving ahead and now you are studying a whole, the patient from head to toe in terms of obstetrics and gynecology. The same patient will be in front of you in your part three, and you have to apply the same knowledge to part three, because you are going to have role players, okay, or you can say the patients, all right, and you have to apply the same knowledge to that patient. So what is so difficult? Difficult is what? Difficult is us. Difficult is our approach. Difficult is what we think about this exam. Difficult is how we execute and how we start. Okay. So this is about modules. All right. And then if we talk about that, how and where we are going to find the sources to study these modules. So generally speaking, exam is going to be of two papers. All right. Hmm? So the generally, the exam is going to be of two papers. Yeah. Okay. Exam is all about multiple choice answers. So we will have single best answers and we will have extended patch questions. Okay. Exam is going to be of 3 hours each duration, and it will have almost, the single best answers and EMQs. 50 single best answers, 50 EMQs. This is going to make total 100 questions. Yeah. Total 100 questions. And out of weightage for exam is going to be more for, this EMQs, 60%. 60%. Extended match question. Sandaleen, so far it is computerized. Okay. So far it is computerized, like your part one. All right. So we don't know what will happen since the things are evolving. So nobody can say anything. But till this January exam, it was computerized. All right. All right. So coming back to this, 60% of paper is going to be of EMQ marks. Okay. Pass marks and 40% for this. So this is going to be like scheme that 50 questions, single best answers, 50 questions, EMQs, 3 hours total duration. Marks are going to be 40% for single best answer, 60% for this. Generally, you give 70 minutes for single best answers and 110 minutes for, the extended match question. Okay. Because by the time we enter into this part two, things are going to be easy because we have done single best answers in our part one, isn't it? So we know the basic concept of single best answer, right? Single best answer. Yeah. Sometimes what happens is that two choices may look similar or may sound correct, but what you have to choose? The best one. Okay. So one paper, then you will have a break, then you will have two papers, second paper. Now marking systems I have told you earlier, and now comes the curriculum. Major bulk. Now please, all of you guys, listen to me very carefully and attentively. Major bulk is green top guidelines, nice guidelines, freely available on website. Okay, another sincere advice to all of you. Be little, the tech friendly. Okay, learn to use Google. Okay, properly. Google is going to be your best friend throughout your part two. Anything you need, you can Google. Sometimes you don't find any source, so you seek help and you ask your seniors or you ask your teachers or mentors around. So yes, you will get help. All right. So green top guideline freely available on website. Nice guidelines freely available on website. All right. Let me tell you that how you are going to browse as well. So hang in there and let me open another window. So I will give you an overview as well that how you are going to use that. All right. Okay. So I am opening green top guideline. Okay. Can you guys see the screen now? Yeah. So you will type on, the Google rcog.org.uk. Okay. So this window will open. This window will open. You are going to go at guidance. It's written green top guideline. See, you have clicked and almost all guidelines are there. Okay. Go little down and you will see in 2023 there was only one guideline which was updated on 19 June, recurrent miscarriage. Click on 2022, you will find a whole list and see almost all guidelines are freely downloadable. So don't look for somebody to help you. Be your own help. You need anything? Okay, Google, find out. Is it so difficult? No, it's not. All you need to do is use your phone or laptop or anything which you use for yourself. Okay? And go for it. For example, I want to study any guideline. I want to study maternal collapse in pregnancy and puerperam. I will, click on that. Another window will open and it's written access to the PDF version and access to the web version. So I need a web version because I want to study online. So the same guideline will open. See, this is guideline. Yeah. And now I want PDF. Okay, go to PDF. So this is PDF. Hmm? Difficult to browse? No, right? You guys can print it as well because many of us don't like online study because of course we are working in hospitals and we are going, so we need and we try to prefer the hard copies, isn't it? So you can buy your own printer as well. You can print it for yourself too. Yeah. See, things are going to be easy only if you really want to make your life easy as well. So this is Royal College, the guideline, almost all freely available guidelines. All right. And now you have to browse, I want to study diabetes in pregnancy, nice guideline, or I want to study hypertensive disorders in pregnancy in guideline. So I will type diabetes in pregnancy, nice. See, hypertension in pregnancy, nice. Diabetes in pregnancy, nice. So now another window will open. See, nice ORG. Yes. It will open. Okay. The same, the procedure is going to be there. If you want to download it, download it. If you want to read online, you can read online as well. Okay. So this is how you browse. This is how you learn how to browse. All right. So all these two sources are freely available. See, diabetes in pregnancy, management from preconception to the postnatal period. Okay. And it is recently updated on 16 December 2020. All right. I want to download. Okay. Download. See, the whole guideline will open. I want to print it. So print, because my printer is attached to my, the computer. So I do like this. Is it hard? No, right? All you need to do is you just need to know how to browse. Or many people, they sometimes they are not that, the tech friendly. So don't worry. Ask. Many of us, are going to help each other. Your fellow colleagues, your peers, your teachers, your course if you are enrolled in. So of course you will get help. All right. So in part two, now another sincere advice. After, the using Google, try to seek help, try to ask help. Don't wait for anything or any miracle to happen. I would never know what you really need at the moment until and unless you are going to ask me. All right. So just 1 minute. Okay. Adan is here. Okay. Just one moment, please. How to know? Um, how to know that which topic is nice? So of course you have to scroll first of all. Okay. And you need to learn. So you need to learn. Okay. And of course, if you are in any group, so things are going to be easy because your teachers or your mentors or your, the colleagues are going to tell you that which source is from which place. All right. So your major bulk is green top guideline and nice guidelines. All right. That makes around 60 to 70% of curriculum. All right. So things are going to be very easy. Yes, yes. Our lectures are very much updated, of course, because we have to teach, and of course we have to be updated ourselves as well. Yes, 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 definitely. Okay. And then comes TOG articles. What are TOG articles? The obstetrics and gynecology. All right. So these TOG articles are going to be from our COG website, and they are published, the 4 times in a year. Okay. Every the 4 months we have one TOG article. And the one TOG article 2, 3, 4 January. Okay. Then we will have April. Then we will have in July, and then October. Okay. 4 TOG articles. then in every TOG article, you will have almost 4 to 5 topics to read. Okay, 4 to 5 topics to read. I will come to that, Hussam. Okay. So just hang in there. Just try to understand what exactly the curriculum is. Okay. And then we will talk about the summaries and all. All right. Now, it 5 topics each TOG article, it will make almost 20 topics a year. Okay. 20 topics a year. Out of 20 topics, not all topics are important in terms of the exam or in terms of the syllabus. All right, so you can skip something, and you can they do something the to read it as well. All right, so if you are in course, so of course we are going to tell you that what are the important things and what are not, but generally speaking, you have to cover almost 3 to 5 years of TOG articles and the topics which are not covered in these recent 3 to 5 years. All right. So how many sources we have covered so far? This is Green Top Guideline, NICE Guidelines, and third is TOG article. We are just talking about the curriculum at the moment. All right. And then comes BASH Guidelines. What is BASH Guidelines? BASH Guidelines is British Association of Sexual Health and HIV. All right. So not all guidelines are to be read for part 2, because we are not expecting, or RCOG is not expecting you to be a consultant of only STDs. Okay. So of course, at part 2 level, doesn't matter if you are an independent consultant in your own country or if you have done so many things. For RCOG, you are a student. All right. So from now on, another sincere advice: think like a student. Okay. Act like a student and behave like a student. All right. Don't think that, if I am something, so what I will do. No. You have to think that I am a student and what RCOG wants from me. RCOG wants from you only basics. All right. They at the moment they don't expect consultants, right? So you need to do only important infections. What are important infections? Chlamydia, gonorrhea, okay, syphilis. You have to cover trichomonas, right? Day to day, what we see in our practice as well. At the same time, all these sexually shared infections are important. Then this is another, the NHS cervical screening program. This is the colposcopy guideline. We have to cover this. Then we do have Faculty of Sexual and Reproductive Health guidelines, contraception guidelines. Okay, stop here. FSRH is an individual body in UK. Okay, because they do give, the membership exam. They do give, there's something else as well. Okay, so there are so many things for FSRH, the guidelines. All right. So of course, again, this is a specialty, subspecialty of obstetrics and gynecology. At part 2 level, you don't have to cover almost all guidelines. So what RCOG wants from you is at least basics. What are basics? CHC, combined hormonal contraceptives, progesterone only contraceptives. They want, the intrauterine devices, right? Copper coil. They want you to know about Mirena, everything. Then they want, the contraindications, indications for any contraceptive. Then they want how you are going to treat any woman, who is approaching towards menopause, who is having cardiac diseases, the simple stuff, isn't it? So at least you have to have, because FSRH have itself almost 40 plus guidelines. Of course, we don't have to cover 40 plus. At least you have to cover almost all these basics which are important. Because by the end of your preparation, almost everything is going to be interlinked, because exam is not going to be from the one individual source. Of course, exam is going to be through all the sources altogether. All right. Then we do have some consent advices. Consent advices means they are published, the consent advices on same RCOG website. Okay. That if you are going to go for vaginal hysterectomy, what type of consent you will take, how you are going to tell to the woman that, okay, what are the serious complications, frequent complications, rare complications, and how you are going to deal with them. So yes, because on RCOG website, you have almost, the 15 or 16 plus consent advices. So you have to read them. There are going to be plenty of numbers. So yes, you have to memorize them as well. Some good practice paper, not all. This is also from RCOG website. All right. This is from RCOG website, freely downloadable, freely available. Then you have to do this, this MB race report, you know, confidential inquiry report of the last 2 years. all right? That what was the major cause of direct death, indirect death, the whatever now, which one is at the highest rate and blah, blah, blah. So that's why we call it as MB report. So these three things are going to be done close to exam. So what is going to be your focus in all these upcoming months? Bulk. Okay. How you are going to say 60 plus guidelines are from RCOG from 2010 to 2023. Recent one is this, which I have shown you just, okay, on RCOG website, recurrent miscarriage. And this is, the 2022 guidelines. This is how you say, okay. Then question arises, how you are going to read a guideline. How you are going to read a guideline. First of all, read thoroughly. Husam has asked me one question, that what about summaries? Yes, summaries are good to do. But when you think that you don't have time, when you think that you can't read, the one particular guideline, but because this is the beginning of preparation for your exam, I would humbly suggest and the emphasize on this thing, that please read guideline thoroughly yourself, because you have to make your concept. For example, I am making one summary, and the something was not important for me because I already know about that. So I'm not going to write down in my summary. All right? Summary is what? Summary is individual's perception about, the one particular topic. Isn't it? Yeah. So you need to be very careful. And I would suggest, because this is the start of your, the journey for part two, read one guideline thoroughly. And if you are a person who makes your own notes, like for me, I'm a person who try to make my own notes, okay, my own, the points, which really helps me. I have done my part two back in 2018. And can you guys believe that I still have my notes with me? Okay, I still, and I do try to update them as well on, and those notes really helped me throughout my, the other exams as well, because RCOG is a standardized exam, right? So nobody can challenge you. Nobody can say something that, okay, this is not written, this is out of box, or this is out of syllabus, or this is out of, this is not recommended. So yeah, we can say that, yes, I have read it, and this is recommendation. So for me, I note down recommendations, important one. Okay. If you can type, you can do that. Okay. In soft copy, if you want to write down in, the on your, the register or notebook, that is your own choice. So what you need to do importantly, incidence, prevalence, recurrence, charts. Charts mean algorithms. Many of the guidelines have, the beautiful, beautiful algorithms. Yeah. So those algorithms are very much important. Almost, many clinical aspect, many exam aspects are going to be covered from those algorithms. So from now onwards, what you are going to do is, if you have bought your own printer, okay, so this is going to be another piece of advice for all of you. Okay, if you are reading, if you have downloaded one guideline, and if you see anything which is important, for example, any algorithm, any chart in the guideline, okay, print it, print it there and then, and make a separate folder for that. All right. By the end of your preparation, you will have your own notes ready, your own algorithm folder ready to revise from, and things are going to be very streamlined, and things are going to be very beautiful for you. This is what I did, and this is what we did when we were students. Because back in 2017-18, we never had, some, the guidance. We learned through our own experience and mistakes. Okay. So what I have learned through is that, this is important, that you do your own, the guide. Okay, you take help from here and there, and now, uh, um I feel that, now this is a very good era, and that free help is available, paid help is available. Whichever suits you, you can take that. Okay, whichever is feasible for you, you can take that. Like at the moment, we are in a session, and you guys are listening to me, and I hope this is going to be very helpful for all of you. Okay, so from now on, because this is the start of your preparation, so the organize yourself. All right, make separate folders, and for yourself, and try to be in streamline. Okay, so note down prevalence, recurrence, recommendations, important thing. Okay, and this is going to be a very beautiful thing if you do it for yourself. Don't look for don't look for that somebody will come and do all these things for you. Why not you yourself? Do it. Who is stopping you? Nobody, right? Like I said earlier, we ourselves are hindrance for ourselves in many things, especially for studies, because we always look for shortcuts. So please mark my words, my dear all right? Don't look for shortcuts for this exam. Anybody, trust me, I am teaching for I think 6 years now, 8 years in fact, 2016 and now 2024. I have seen so many students. Can you imagine? I think thousands or maybe the more than that. Okay, so students or candidates who look for shortcuts, they really face the hard time. Okay, the students who really want to do this exam properly and nicely, they don't look for shortcuts. Shortcuts are not good at all. Okay, for such competitive exam, which is very the in terms of syllabus, you can say bit difficult, because syllabus is so huge and vast. Okay, plus on the other hand, it is bit cumbersome as well, isn't it? It is like, I mean, it is going to put an extra toll on your health, mental health, physical health, not to mention financial health as well, isn't it? Because all exams are very costly, right? And keeping in view of current, the inflation and all, everybody is going through one or the other thing, tough times as well. You have to be very careful, while for this exam, isn't it? So please make sure that one attempt or the first attempt is a thorough attempt, is a good attempt. You have studied smartly, nicely. You have given your 100% input into it. And you are going for this exam. Okay, brilliant, well and well good, right? Nobody knows what is going to be the result. But at least by the end of the day, you have this confidence on yourself that, look, I have given my 100% to this exam. So at least I am satisfied that I have studied. Rest, that exam day is little bit, the different and challenging from whatever you have done in the last, the 6 months or 5 months. All right. Because circumstances are different, time zone is different. Plus, the stress level is different. Many people, they don't have that much, the capability or say the capacity to cope with stress or something like that. Okay. They get shaky. Many people, they become underconfident. Okay, that particular day is going to decide for your result, not your preparation. All right, everybody studies for this exam. So far what I have seen, that yes, if I have the 250 or 80 students in my one course, so I do see that 200 people are studying and 50 people are not, the even attending or even the paying any attention to anything. So what? Okay, so it's not going to be like the bad. Okay, so all you need to do is you have to give your 100%. All right. Be the best version of yourself when you are studying or aiming for any exam. Yes, every exam will have different challenges because of the syllabus, because of the the curriculum, okay, or anything. All right. So go for it. I would not suggest that delay it. If you have done your part one now, so go for the this part two in the July. I would not suggest that wait for another 1 year and go for January 2024. Nobody can study for ages and years, isn't it? So why not now? Okay. If anything whatsoever, if you are in such bad circumstances that you can't study at all, then yes, you can take time. Okay. Somebody has asked me that I am in training and I have my IMM in August, and everybody is saying, why are you telling it to everybody? This is your exam, first of all. Okay. Secondly, you know your circumstances. IMM is no different. Okay. FCPS syllabus is almost same like MRCOG. Single best answers. So what is the hindrance? Same syllabus. Okay. You have to study Dewhurst. You have to study EBM. So what is EBM? EBM consists of your guidelines. Okay. So syllabus is same. All you need to do is that, yes, you have to put your extra effort, because single best answers will cover your IMM as well as your this MRCOG part 2. All you need to do is you have to work on EMQs. Okay. And now you know the training and everything, because you are better judge for yourself. Okay. That if you can spare 4 to 5 hours every day consistently, you can do this exam so easily. While I was preparing for my this exam, I was working as a full-time registrar. Okay. So yeah, I was working, I was studying. So we don't have any other choice. If you will wait for years to end something, so I hope and I think that you are losing time. Okay. So give your 100%. Try to, again, you can be, because I can't fit in your shoes. So I don't know what circumstances are with you. But for training, with IMM preparation, I think this is good to go. This is a good choice, I must say. Because syllabus is same, everything is same. So what's the hindrance? What's the problem? No problem for me. But still, go look, that what exactly you are going through, what is your training, the period, and how about the the duties and all, because every center or every hospital has different the pattern, right? Now, this is what I do. I have separate folders till date, and I use them. Still I use them. Nice guidelines. Somebody has asked me, I think Sabah, that how many nice guidelines are there? 15 to 20 guidelines to be done from nice guideline. So what are the important nice guidelines? Diabetes mellitus, hypertension, subfertility, urinary incontinence, mental health, cesarean section, intrapartum care, menopause, postnatal care, surgical site infection, long-acting reversible contraception, but now it is archived in induction of labor, preterm labor. Okay, stop. What importance do you see in nice guideline? Almost all important medical disorder, infertility one module, incontinence one module, labor and delivery one module. These three big modules are being covered by nice guideline. Okay, are you there? Are you with me, guys? These are important nice guideline, but of course, if you will sail through this journey, you will come to see yourself as well. Learn to browse, learn to at least, look at the guide, the website every other day, fortnightly, every fortnightly. Even if you see that, okay, is there any updated guideline? Is there anything which I need to cover or study for this exam? Then how to read nice guideline? Because nice is not that nice. Yeah, because Royal College guideline, RCOG or Green Top guidelines are straightforward because those are clear recommendations. Recommendations mean that we have to follow. In nice guideline, you need to read each line carefully. Each line. If I say each line, it means that you have to read everything so carefully. It's not going to be very nice initially, but when you will go through it once or twice or maybe thrice, okay, it will be very easy. Then it will be very nice. In fact, it will become very nicer to you. So what you need to focus in nice guideline, there are going to be certain buzzword, or you can say the certain words which needs to focus on. Okay, there are going to be word offer, number one. Then there is going to be consider. Then third word is going to be discuss. Beautiful, isn't it? Now, how you are going to differentiate and what you are going to memorize for yourself, for your exam. Offer means now you have to offer somebody. It means you have to give this to any patient by hook or by crook. It means it needs to be given by all means. Consider mean plus minus. Outweigh the risk and benefits. You will consider and you will talk to the patient. Then discuss with family, discuss with partner, discuss with patient herself, discuss with consultants, obstetrician. Yeah. Okay. These things are going to be very important. For example, in preterm birth, we do offer antenatal corticosteroids, right? So this is a rule, general rule, global rule, that we have to give antenatal corticosteroids in preterm birth. Okay, we have to tocolize women. To why we do tocolysis? Because we have to give antenatal corticosteroids. So certainly, if we feel that a patient is in true preterm labor, we will offer them. You know, if membranes are not ruptured, if patient is not into chorioamnionitis, if patient is not having any other infection, so we will tocolize her and we will give her antenatal corticosteroids. Now, antenatal corticosteroids has some gestational ages in which we have to definitely offer, we have to consider, or we have to discuss. For example, extreme prematurity, 23 plus 6, 23 weeks and 6 days. We don't know what is going to be the outcome. So we will discuss. We will discuss what will happen if we give, what will happen if we not give. So we will involve the whole, family, partner, patient herself, consultant. We will discuss, right? Consider, for example, 27 plus 6 days. 28 to 32 weeks is going to be that, yes, we have to give 27 weeks and 6 days. All right. So we will consider either we have to give, we don't have to give. Okay. So this is how nice guideline is to be read. And things are going to be very, the beautiful if you will understand the essence of how to read and what to focus on. Then you have to memorize, of course. Okay. So, how you will memorize? You will repeat things, you will revise. Repetition is the mother of memorization. So, if you will repeat things, you will memorize easily. And of course, if you will memorize, this will help you in your exam. All right? Is it clear so far? Any question? I hope I'm making sense. Yeah. Moni, Sabah, and everyone. Yeah. Clear? Hmm? Okay, Amara. Very good. Shahtaj. Good, good. Okay, very good. Thank you. All right. So now comes tog articles. So this is another, the thing to catch. Tog article is going to look like this. Okay. Some few tog articles are freely available to download from, the Google. Okay. Some are not because they need, the subscription. But sometimes what happens is that, the many candidates or many, the people, they do share here and there. So we can collect them. Okay, from Telegram, from Facebook. And if you are part of our course, so of course we will provide you guys. All right. And this green type, the paper, these charts, again, almost all these charts and all algorithms are going to be important. Formula will remain same. Because if I'm studying and if I have studied this talk article, so what I will do is I will get it print again. So I will keep it in my printed folder to revise in the end. Hmm? So it will make things easy for me, isn't it? So it will be very easy. Okay. So once you will read nice guideline, you will understand. Okay. So almost last 3 to 5 years talk articles are, to be done. Some of them are easily downloadable from Google if they are free. Okay. And some of them are not downloadable. So you can get help from here and there. No problem. Okay. Now, the 3 to 5 years talk articles are important, but some of the talk articles are very old. Okay, like cystic fibrosis, headache in pregnancy, enhanced recovery program, nerve injury, spinal cord injury, skin eruptions, hyperprolactinemia, surrogacy, SLE, appendicitis in pregnancy, abdominal incisions and sutures, cerclage, infarction, bariatric surgery, thyroid dysfunction, borderline ovarian tumor, polyhydramnios, hmm, asthma, liver masses, management of fibroids, management of ovarian cyst in pregnancy. So almost all these talk articles are, the old but important because you can't miss, all these important talk articles at all. All right. So from site, nothing is downloadable. You can open, you will have access. Okay. And you can study. But yes, if there is any open material, that will be shared. Okay. Website is not downloadable, of course. All right. So how to read talk article again? Talk article is personal perspective about something. For example, I want to study inflammatory bowel disease. So what I will do is I will try to, gather data. I will try to find out that what exactly has been done so far for inflammatory bowel disease, and then I will try to study. Okay. So you have to study talk article like a story. All right. So you will read this talk article like a story, first of all. Okay. Again, you will note down important points. You will focus on tables and algorithms. Most of the time, single best answers will come from talk articles. So those are going to be straightforward. Okay. Those are going to be pretty straightforward. So If you have read nicely, if you have read, the perfectly, so things are going to be very beautiful for you. Okay? So three things so far important curriculum. Almost 60% is going to be your guideline, and rest, almost 20 to 30% is going to be tog article, and rest 10% is going to be rest of the syllabus. So what you will focus on? Anyone? What you will focus on first? Hmm? Bulk.
Guideline.
Bulk, of course. Yeah, guidelines. Thank you. Okay, so don't worry about if somebody was talking about bash guidelines, so I have to study bash guideline first. Come on. If you will study bash guideline first, okay, and if you want to study those guidelines, lengthy guidelines, it will take a lot of time. Okay. And you don't know in the beginning or in the start until unless you have taken any guidance or course or something. So you don't know what to study specifically and categorically. Okay, so what you will do if you are studying yourself or even with course, and this is how we design our course as well, that first we cover, the important, the modules. Okay, almost all modules, and we do, because by the time, alhamdulillah, we are so well read that we know which thing is coming from where. Okay, what is the source? Okay, so we know, so we do try to design our course accordingly, that this thing is very much important, so we have to cover it first, and we have to cover our bulk first. All right. So first we will cover guidelines, almost all green top guidelines, nice guidelines. Then we will focus on TOG article. Okay. And then in the end, we will cover batch guideline or FSRH guideline or anything whatsoever. Okay. So single best answer and EMQ practice is very much important. Why it is important when you are studying? Because it is going to enhance your thought process. It will give you an overview that, okay, what thing is coming from, where is it coming from, why the answer is this, how the answer is this. Okay, and when I have studied this or whatever, because this is going to challenge your studies, that okay, this is how you have studied so far. So sometimes what happens is that initially, okay, don't do anything initially, because the start is going to be little bit, the challenging, because this is 100%, the different, or you can say 365-degree different from part one. Part one is straightforward, but in part two, you have to bring so many things at one point where you have to bring, your thorough study, clinical knowledge and everything into one part. Okay, so take, the things properly. And another important thing, don't ask that how long is going to be the session. Okay, because this is very important. All right. And roughly, if you are part of our course, okay, roughly part two sessions are going to be 3.5 hours, or maybe 4 hours as well. All right. But not this session, but of course, if you are studying or covering any module. Okay. So your stamina needs to be improved. You need to have a good stamina for part two, good, the strength, positive approach. Okay. And of course, you can say the will power to study and to go for this exam. All right. So, Nisha, don't ask me this question again. So you have to practice question as well, just to find out that are you on right path? Are you on right, the thing that you are studying in right direction? All right. That whatever I have studied so far, that is it covering my, single best answer or extended match questions or no? All right. So this is what you need to do. So we have got couple of books, very nice books. We have got single best answers. Okay. So almost all books are, available on, you can say if you are part of course, so of course you are going to be given. Otherwise, almost all books are freely available here and there. Okay. In almost Facebook groups, Telegram groups, and so on and so on. Plus, if you, I would suggest that buy them. Okay, or if you can't buy, you can print them as well. Okay, because that is going to be very easy for you. Everything is important. Okay, every book is important, because you are in practice phase, so you have to practice. Exam is not going to come from this book or this book. These are practice books. Another things to erase. No book is important. Okay, theory, we don't have any theory book for MRCOG. We just study guideline. Okay, Zarina, we don't study any theory book in part 2. We just study guidelines. Our curriculum is guidelines. So far, have I said something about any book? No, right? These are practice single best answers and EMQ books. So we have got Enthusizer, we have got Rekha Bhutankel, we have got Justin Kune books, Brian Magowan books, Amanda Jones, Seema Sharma, Janish Gupta, Succeeding, and Tahir Mahmood. Personally, I love this book. I love this book, this one, this one, this one, then this one, Tahir Mahmood. And then later on, I will do these 2 books or 3 books. All right. EBM is for your FCPS, not for this exam. Okay. That was for FCPS. Please don't take otherwise, because you are asking so many questions at one point, so you have to cover. It's not for MRCOG. Please, no theory book for MRCOG, guys. And this is EMQ books. All right. This is Justin Kune books. This is Get Through. This is the Rekha Bhutankel. This is P Sinha. This is Succeeding. Okay. Again, another thing, because not every book is updated. Our guidelines are updated. Some of the keys are going to be from old guidelines. So what is your job? Because you have to practice as many questions as possible. All right. But keys needs to be from your new guideline or revised guideline. So be extremely careful. Okay. I would definitely 100% suggest that do go through all these guidelines, because you have to practice. You have to practice as many questions as possible. So do take all these books. All right. Buy them, hard copies if you can. Okay. Almost every good medical store will have almost all books. Buy them. Okay. Try to do them. And now question arises how you are going to utilize. Okay. Because I understand. I've been through the same phase twice. Okay. So I do have 9 books, and today I have studied asthma. What I will do is, first I will pick this book from index. I will do all asthma, the questions. I have done this book, kept aside. I have taken this book. I have done asthma from here. If I have, then this, then this, then this, and then the other one as well. And then I did try to cover, almost all books. So by the end of the day, okay, I'm at peace that I have done something. Another good approach is, like, for me, me and my best friend, she was from India. Okay. So we have studied, together for almost all parts. So we used to study over phone. So what we used to do was that, all, of course, she was working, I was working. So by the time we do try to reach home, so we used to, the study. And then we used to, the divide books. For example, I have 10 books. So I used to give her 5 books, and, 5 books for me. So I used to open this, and I used to tell her that, okay, look, asthma is here. Okay, asthma is in this book at this page, at this page, at this page. So she used to tell me that, okay, Zaib, the one question is in this book and one question is in this book. This is another approach. So if you don't have any study buddy, doesn't matter. Be your own study buddy. Okay, be your own, the help or guide or anything. Don't look for, the shortcuts, and don't look for somebody to help you. Nobody is going. When we drown, who comes? No one. Until unless, we find any help. So you have to sail your own, the boat, isn't it? So please be on your toes. Don't look for any shortcut. Don't look for any summaries at the moment, in the beginning or the start, I would suggest. Okay. Do try to go through syllabus yourself once. And then in the end, of course, if things are going to be there, all right. So this is going to be the challenging. So then of course you can go through summaries. Okay. So this is really, the important, that at least you read everything, the properly first, study, and then you go for it. Dr. Sugra, of course, you will get everything. Okay. We are not talking about course at the moment. I will talk about course in the end. At first, I have to speak about that what this exam is all about. Okay. So don't worry about it. So this is not about, the course at the moment. So this is a general talk. All right. Sweetheart, for FCPS, do talk to me in person. At the moment, I'm not talking about FCPS. Please don't mind, okay? Because then things are going to be very, the challenging. All right, to understand. So just focus on MRCOG at the moment, and then look for another thing. Then comes online sources. Okay. So we do have strategy e-learning, very good online source. We do have Pass MRCOG. So at least you have to go through 2 to 3 times. You have to do questions again, you have to go through questions. You don't need to memorize keys because exam is not going to be from keys. Okay. Exam is not going to be from that book or that book or that book particularly. Part two is little bit challenging in terms of that if your concepts are clear, you will pass this exam properly. Okay. Clear so far? Clear so far? Hmm? Now you have a good idea what this exam is all about, curriculum, okay, and how you are going to approach. Clear so far? Any question? Any ambiguity? Any problem? Okay, very good morning, Sandaleen. Thank you. Dr. Subra, thank you. Okay, now we will talk because I'm a teacher, right? I've seen so many students all around the globe. Okay. So I know we do fail, we do pass as well. Okay. I have failed this exam once, and then of course I have passed this exam too. That's why I'm sitting in front of you at the moment. Okay. But generally speaking, there are some strategies which we need to follow. Sometimes, or everybody wants to talk about, the pass, how to pass, how to pass, how to pass. But generally speaking, first of all, I want to talk about how to successfully fail an exam. Mhm. Different, isn't it? See, look at the approach. How to successfully fail an exam. Lack of confidence. I cannot do this because this exam is so difficult. I can't do this because somebody from my hospital, somebody, my senior, my junior, she was so discouraging and she was talking that, you cannot do this exam. So I can't do this. Although I have passed so many exams before, but now I feel that I can't do this. One reason to fail. Another reason to fail. Oh my God, this is a piece of cake for me. I know so many things, you know, because I'm a very, the strong candidate. I was a position holder and I was blah, blah, blah. Okay, I know I can do that. Then following too many advices. You will come out of this webinar, you will enter into another webinar or any other thing. Okay. And of course, you will have plenty of sources, plenty of advices. Everybody has different approach. Okay. Every teacher teaches differently. It doesn't mean that my approach is bad or your approach is bad. It means, approach is as long as we are okay, we are, the clearing concept or we are teaching properly, we are guiding properly, we are good, isn't it? But for you as an exam candidate, what is going to be bad for you? You are giving 3 hours here, 3 hours another, the webinar or 3 hours here and there, and you are having loads of advices by the end. And you are now, I don't know, stand where? Again, following too many sources for one topic. Uh-huh. This is such a bad, the deal. Because we are doctors, I know. I've been through, the exams. So I know that this is almost a habit of almost all doctors all around the globe that we really want to study in depth. We really want to dig something, you know. Because we love to, I'm sure all of you do like I do. I love to buy books. I love to collect books, medical books and other books as well. Okay. So I have so many sources. All right. Because I really don't want to, take anything from anyone. If I need to study now, so that book has to be with me. But I should not open, for example, we are talking about asthma. Let's take an example of asthma. Because our recommended source is TOG article. In TOG article, asthma is given so beautifully and nicely that you will never forget in your life how to manage pregnancy with asthma, right? But same asthma is given in, the big books. Same asthma is given in some other medical disorders book. Because I have so many books, so I am going to read the same asthma from here, from here, from here. What is it costing you? Your time, your brain cells, your concentration. By the end, what you are getting? Almost nothing. Because some of the books, they are not following, the one particular guideline. Okay. Because every country has different, the college, different guidelines to follow. I'm sure you guys are aware of. American college is different, European college is different, Canadian college is different. and Royal College of Australia and New Zealand is different, and then of course Ireland, and then comes our UK exams. Yeah. So maybe in one theory book it was written, no, something else, and now I am confused what to memorize. So what your job is as an MRCOG candidate, what you will choose, what you will choose, Lubna, to study. For example, asthma, if I'm asking you, what you will study? Hmm? Tog article. Tog article. Nelson Piracy is a good source, but I would not suggest at this level. Okay? I would not suggest. I literally love that book. Okay? But at the moment for MRCOG, I will not suggest you to go through. Okay? Because our main bulk is talk article and guidelines. Trust me, by the end of this session, if you know what your curriculum is, trust me, I'll be successful in conveying my message, that my message is very clear across this webinar, that now my all candidates or attendees know what this exam is all about. All right, very good. Okay, now following so many or almost every single group on social media, I'm on WhatsApp, I'm on Telegram, I'm on Facebook, I'm enrolled in this course, I'm enrolled in this course, enrolled in this course. Okay, what is end result? End result is I stand nowhere, because I have given a lot of time to study one particular topic. I have opened so many things because I really want to dig. I really want to study nicely, and I really want to become an asthma physician by the end of this study. Okay. Plus, I have followed, the one group, you know, one ABC group. Then I have followed, the DEF group. Then I have followed another group. What I am getting? 1,000 messages in this, 1,000 messages in this, 1,000 messages in this. Anjali, what are you getting by the end of the day? Anjali, what are you getting by the end of the day? 1,000 messages reading here, nothing.
Nothing.
I really want to hear one thing. What are you getting by reading so many messages? Headache, eye strain, you know, eye strain, headache, anxiety, Sandaleen, that's my girl. Yeah, and anxiety. For me, this is going to headache. This is going to be headache, because screen time is very bad, isn't it? Depression. By the end of the day, see, please don't, they take me wrong. I'm not saying that all these sources are not helpful, but choose your battles wisely, choose your help wisely. Okay, choose your sources widely as well, isn't it? So if I am enrolled in so many, the groups here and there, so what is happening? Let me, because this is our habit, we will get so intrigued. Okay, Sandaleen has answered this, Anjali has answered this, Lubna has answered this, Subra has answered this, Husam has answered this. Yeah, somebody else has answered. Okay, let me check what is the answer. Hmm? Because all of us are student, isn't it? And we do get intrigued sometimes. Yeah, but for me, being part of so many groups is really costing you your energy, because at the same time you're working in hospitals. Maybe you are working, the mom, or the daddy or whatever. You have to take care of your house, you have to take care of your own health as well. Your own physical health, your own mental health is equally important. Very good, Hosam. Thank you so much for getting my point. Stick to one source. Okay. Don't become a demotivated, frustrated, and a lost exam candidate in the ocean of a lot of knowledge, in the ocean of so many groups and all. Don't be a frustrated and lost candidate. Okay, got my point? Exactly. Too many cooks spoil the broth. Brilliant. So what you need to do is you just need to stick. Yeah, slow reader, Anjali. I do agree with you, sweetheart. But the thing is, at the same time, you know, you need to save your energies too, because if all the time you will stick to your the mobile all the time, so it will cost you your energy. Trust me, screen time is so bad. Okay, screen time, sometimes what happens is you can't even focus, things becomes blurry. Okay, and plus, of course, if we are giving a lot of time to screen, so it will cost you your eyes, your energy, and everything, isn't it? So please stick to whichever group you love to, or to be in. Okay, anything, so stick to that thing only. Okay, Nobody is here to misguide you. But the thing is, you have to choose your own, I must say battle, because this exam is really a kind of the battle. Because like I said earlier, that you have only 4 hours, 5 hours for yourself to study. If you will focus, sweetheart, that is not my Abu's website at all. Okay, I work there. I'm a teacher, so I cannot allow anything, because personally I don't know. I'm not even allowed as well. Okay, so so the thing is, I can't do that, because by rule, because we have been hired, of course. So we are a teacher. Okay, so please give us this the opportunity that we can guide you anything, so we can teach you anything. So do try to go through, read your guideline properly. Okay, so please don't let this thing happen to yourself. Demotivated, frustrated, I don't know what to study. Plan ahead. Plan ahead. Okay, now good thing, key to prepare, how to successfully pass this exam. Okay, organize yourself. All right, see, this is a dangerous thing you are doing at the moment, Shmaila. You are thinking other way. Why are not you thinking that you have to put your 100% into this exam? Why don't you follow? Why are you after only, the downloadable things from website? This is a first negative approach towards this exam. Okay? Please listen to me. Okay? First try to absorb what I'm trying to convey. Okay? So general advice to study for this exam is, first of all, organize yourself. Make folders of all modules on your desktop, laptop, iPad, MacBook, or even you can get them printed as well, which I have told you earlier. Have a good grip on all salient points from good guidelines and TOG articles. Emphasize on facts, figures, percentages. Post as many questions as possible from all available pool. Discussion. Discussion helps, because if I'm telling you one thing and Anjali is talking to me, Sugra is talking to me, okay, somebody else is talking to me, Lubna is talking to me, Shmaila is talking to me. If we will discuss, one particular, for example, we are talking about asthma today. Let's take an. So I said that asthma incidence is this. Yeah. Lubna said, no, doctor, it is not that. Anjali said, no, 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 it is this. Sugra said, yes, it is this. So Husam said, yes, this is this. So what is happening? By the end of the day, I memorized what is incidence of asthma. Even if I don't, if I see any question, so my brain will click. Oh, yes, yes, yes. Husam has said this thing at that point. Lubna has said this thing at that point. Shwaila was talking like this. See, brain has a capacity to recall recent knowledge, remote recent knowledge, and the past knowledge as well. Trust me, when you will be in exam hall, you will remember so many things, even from your graduation time as well. Doesn't matter, when it was. Because we human being and we doctors are built in almost, with knowledge. All we need to do is refresh and focus. All right. So discussion helps. And this way you will see questions so many times. Okay, so discussion will help. So discuss. Again, I will say the same. Please don't wait for any miracle to happen. Don't wait for me. Don't wait for Dr. Zaib. Don't wait for anybody else to come. You know, yes, you can ask me. You can call me anytime. You can take help. All right. But first, try to figure it out yourself. This will really help you because in your thought processing, in your own, the if your neurons will work yourself, you will memorize it nicely. Okay, whenever there is any confusion in topic, cross check from latest dog articles or guidelines. This is what I love to do. Make your own small notebook, note down all important points, discuss with a study partner if possible, otherwise no problem. Take part in discussion on groups. So many free groups are there, like for us MedExam, we do have MedExam expert Telegram group and Facebook group as well. Okay, we do discuss. Doesn't matter, our aim is to impart knowledge properly. Okay, me myself, Dr. Zaib, I have been working for free for so many years. Okay, been teaching, been guiding, been, I don't know, helping around. So doesn't matter. At the same time, I'm working as well. Okay, so that's my separate, the kind of field of work. That's my separate, the work. So what? Do discuss, raise question, ask me, ask any other mentor. if you wish to join any free group, do it. Okay, do it, no problem. So first reading should finish in at least 3 to 4 months, and then you have to revise them again. Okay, stop. I am a very good student. I have a very clear concepts from my background. Okay, so my one reading is enough for me. It doesn't matter. Somebody else, like somebody said that I'm a slow reader, no problem. You will finish your first reading in maybe 3.5 months, so no problem. But still you have a good concept, so take those concept. Maybe one revision is enough for you. Everybody has, mark my words, my dear all, everybody has different capacity, different, you can say that, capability to retain, to reproduce knowledge, or to study. A- Again, another sincere advice: don't compare your journey to anybody else. Okay, this is another golden rule for this MRCOG, because we all go through, the different circumstances, right? I don't know what is happening in your life, you don't know what is happening in my life. You can't fit in my shoes, I can't fit in your shoes, right? You know your circumstances better, I know my circumstances better. So don't compare. And plus, another thing which I see in so many candidates, we get impressed so easily. Oh my god, Hussam is active in that particular group, and the Hussam is active in that group as well, he's answering very nicely, and he's a very good candidate. Hmm? So this is not something, because social media is not about the reality, or social media is not, maybe Hussam is not working, maybe he's home all the day, okay, because one of the other reason. All right. So he has to get indulged. He has to study. So he is making himself available in almost all groups. But it doesn't mean that, he's not putting his efforts. Or maybe, the many people, they love to be, the here and there all the time. Okay. So don't get impressed. Okay. Don't impress. Don't make a impression out of anything that, okay, that person or this person or this thing or this thing. All right. Be your own judge, be your own critic, and be your own help, first of all. Apart from that, of course, help is available. Free help is available, as well as paid help is available. So please seek for that. Who is stopping you? No one. No one. All right. So this is very important that you study properly. Again, let me clear this thing. Let me clear on this thing. There is no theory book for MRCOG. Okay, only guidelines is our curriculum. That is our complete theory. Okay, you don't have to open any big theory book. All right, all right. Okay, MCQs, theory means MCQs and yeah, single best answers and EMQs. Okay, we don't have SAQs anymore. All right, we just have single best answers, 50 single best answers in one paper, and then we have extended batch questions. All right, we don't have SEQs anymore. Okay, short answer questions. We don't have them. General strategies to prepare for a MRCOG Part 2 exam. First of all, be positive towards what you have learned and try to absorb it with examples, reference, and reasoning. For example, I have posted one question today. Okay, I have posted one question and I got almost, the in one group, say any group, Facebook or Telegram, and I got 1, 2, 3, 4, 5, 6, 10 answers. Almost out of 10 answers, 6 are correct, 4 are wrong. Okay. But still, I need to find out because I'm studying for myself. Okay. So I need to know that where this question is from. Okay. So this is very much important. Okay. So what you need to do is that you have to look for that where is it written? Which source? What is the reference? So this will only come with the help of discussion, or with the help of when you will post, or when you will try to answer question, when we'll try to find out the reason for any particular question. Okay, reasoning should be there. Why? Kids, when kids are the growing up, I'm sure you all know that kids ask so many questions. Why this is that? Why this is not like this? Okay, so this is very important, that you become a kid now as well. Okay, if this is a key, I am saying that this key is A, but Dr. Sugra is saying key is B, Dr. Sandalin is saying key is C, Nazia is saying key is this. But key is, according to the book or according to the guideline, key is B. So now let's find out. Can you please, Dr. Sugra, can you please give me the reference? Where is it written? Hmm? So yeah,
Sorry.
she will say that it is written in the green top guideline. Okay. So
Okay.
this is how you find out that where is it written, why, yeah, and what is the reference. Reason should be there. Okay. EMQs carry more marks. Yes, 60%. Okay, in one paper. So you have to work. You have to work hard on EMQ practice, and you have to work hard on both. Because for the passing percentage, every the percentage counts. Even half marks count as well. All right. So we if you are part of our course, okay. So July batch is going to be starting. Today is our first session, and then we will have a complete schedule, right? So this will help you completely. Okay. So this is where we step in and we try to help you practically with all the curriculum and preparation method, as I have told you earlier, right? So we as a med exam expert team, so we do try to give you, the complete, the knowledge. All right. Module wise, you will have live sessions, and if somebody cannot attend live session, you will have recording of each session. And after one module, okay, you will have topic test, or you can say that module test. You will have almost all updated summaries on website, okay, all talk summaries. You will have mock exams. You will have question banks as well. You will have talk question banks as well. Later on, you will have a dedicated study group, Telegram or Facebook, okay. So you will have a discussion. You will have mentorship, of course, and you will have continuous psychological support in difficult times as well. Like I have told you that I've been teaching for 8 years now for MRCOG, right? So I still have a lot of, you can say a good connection with so many candidates all around the globe. They do come to me, they do discuss, okay? They do try to, they get help. Like I said, try to ask help, okay? There should not be any shame or any harm. If you don't know anything, do try to, okay? You have to do everything, sweetheart, because this you are in online preparatory course, okay? You are not in college or you are not in university. So online means that you have to take help for yourself. But again, don't completely rely on almost all summaries, okay? All summaries. Don't rely. Please read yourself first and then take help. Okay. So this is not something that, okay, we are not going to teach you or provide you anything. This is not the question of provision. This is all what you can study, what you can retain, and what you can reproduce. Knowledge should be reproducible. Okay. Knowledge should be reproducible, and part 2 knowledge should be reproducible, because by the end, this is not something that I just have to buy so many things or courses or be part of so many things. This is not going to count. What is going to count? What you have studied, what are your concepts, whether you can the solve any question pools or no, whether you think that you are ready for this exam or no. Okay, so don't rely on ready-made summaries, ready-made, the points, because maybe something is important for me, but this at the same time that is not important for you. All right. So of course your course mentor are going to be me and Dr. Hassan. All right. So we will be with you. Dr. Hassan is our, the very dear and very dedicated teacher. Okay. And he is a MRCOG examiner as well, me myself. Okay. And I'm also a MRCOG examiner as well. So then duration of course is going to be, so from today you will have, till your exam. We will be with you. Okay. And we will have Dr. Rupam as well. She will do daily discussion in the group. Okay. And then of course you will have your live sessions. So, as a med exam expert team, we do try to help you sail through this tough and long journey. All right. So, we do that. We do try to do that. Okay. So, what you need to do, you just need to behold to the schedule and join live sessions according to the schedule by setting your duty roster, by setting your time. If you can't join, okay, this is suggested that please do join live sessions, because one-to-one interaction with your teacher is going to help you understand that topic properly. Okay. Otherwise, of course, things are going to be recorded and uploaded on website, and then you can listen to them as many times as you want to. Okay. So this is going to be a type of, the schedule. All right. So if you are going to be part of our course, for example, now today is our introductory session. On 3rd February, you will have a session with Dr. Hassan, urogynecology. Then you will start with antenatal care. Then you will be with me for maternal medicine module. Okay. Um, yes, very good question. Very good question, in fact. Okay, how many hours? Look, sweetheart, I think initially 3 to 4 hours are enough, because if you will study one guideline, okay, so at least it will take time. And initially, when you are going to concentrate on something, then yes, it will be little bit tough, or you can say the difficult. But once you are going to be in flow, then perhaps 2 to 3 hours are going to be enough. Okay, but do try to concentrate on properly. Okay, and of course, yeah, how quick you can understand or something, but roughly 3 to 4 hours dedicated, because at least you have to study. You have to study. And now nobody has asked me, Dr. Zaib, why maternal medicine 5 sessions? Has anybody noticed that we are going to have 1, 2, 3, 4, 5 sessions for maternal medicine module? So what does it show, Shmaila? Hmm? What does it show? Of course, you're not going to listen to me all the time. It is very lengthy. It is important for exam. Okay. It is clinically, oh, Allahi, very good. It is main bulk of your exam. All right. Big chunk. Very good answer. All right. So, me myself would love to teach you guys maternal medicine. And inshallah, I will make you guys love this module as well. Okay. So you're not going to be the upset, because this module is clinically relevant too. Okay, important too, because if you will study maternal medicine, so yeah, you know if you are studying today diabetes, if you are studying hypertension, if you are studying asthma, if you are studying SLE today, so can you imagine, by the end of even this course, you will have plenty of knowledge, isn't it? So this is how schedule is going to be. Somebody has asked me, then yes, we will have a schedule properly. Roughly, the time is 2 p.m. GMT, because by this time we are free from our hospital and duties and everything. And of course, we do try to design. Sometimes there can be some time change, but we do try to tell, okay, beforehand. So don't worry about it. So this is going to be a long journey, isn't it? You can imagine. This is going to be a long journey. So what you need to do, behold, okay, be patient. Okay, be consistent, be persistent, be a fighter, be a warrior. Okay, like I said earlier, start should be very good. Start should be dynamic. Okay, it has to be very, very strong. It should not be lousy. Okay, right? Got my point? So, for example, now urogynecology is going to be the candidates who are enrolled in course. So from tomorrow you will have a mini schedule on important topics. So for example, on day 1, you will study this. We will provide you with, almost all, the guidelines and TOG articles in group. Okay. You can download them. You can keep them with you. You can print them. You can study them. Then you will have discussion. Okay. Then you will have, the discussion. Okay. With our Dr. Rupam, for example, daily 2 p.m. GMT or any time which she will fix. So you will discuss the same topic with her, same topic with her. Then you will meet with me in my online session. So you will have at least you know, baseline knowledge before you enter into online session. No, there is no precise number, actually, sweetheart, because, every 4 months we get TOG article. So sometimes, we add topics. Okay. Online session roughly is going to be from 3 to 4 hours each, every online session. So please increase your stamina. Part two again is all about stamina as well. If you will get tired after 1 hour, I just want to sleep. Come on. Sleep is not going to help, but study. Okay, so by the time you will enter into this online the session, you will have at least background knowledge, because you have read all these topic once, and then the same topics will be discussed in online session with regard to important exam the points, what to focus on, what single best answer will come from, what is going to be the extended match question. Okay, so, what you need to do is, in the end, you will have, the like we do exam question revisions. Okay. You will have exclusive biostatistics workshop, and then you are going to revise. Once your all online sessions are going to finish, roughly, I think you will be done by the end of May, I believe. Then June is going to be the revision, because in July you will have exam. All right. So make sure that you are starting, and you are starting from today. You are not waiting for another year to write this exam. I think this is good idea that you go for July exam. All right. So, you have to start. Utilize your neurons wisely. Okay. This is going to be another piece of advice. Okay. So utilize your neurons wisely. Okay. Utilize your, the things properly. Okay. The when will be the recorded version, because this is going to be on Zoom app. First Zoom process the recording session, then once it is going to be uploaded on website, it will take almost roughly 8 to 10 hours. Okay, but usually it is uploaded, and you will be notified as well that okay, session is uploaded, and then you can the watches, or you can say the listen to it as many time as you want to, because this is your website, this is going to be with you till your exam date. Okay, so don't worry about anything. Okay, so is everything clear about course and exam so far? So read a guideline properly. This is very much important. You have to write down incidents, recurrence, risk factors, complications, important figures. So once you will go through, I'm sure things are going to be very easy. Okay? Please do ask. Do ask. Can we ensure that every mentor makes every 45 minutes a 5 to 10 minutes break as with grievance? Sweetheart, we cannot promise, okay? Because things are very, the changed in part two. Please relearn or unlearn whatever you have learned earlier. All right. So what you need to do is, again, I said part two is extremely, I must say it takes 365-degree turn. Okay, from part one to part two. All right. So please, first thing you need to do is, okay, what did you ask question? Hmm? You can, okay, let me you cannot download anything from the website, first of all, okay, which is paid course. Things are going to provided you, but those are not going to be the summaries. Okay, you will be provided with, for example, if today's topic is you can say shoulder dystocia. So shoulder dystocia guideline I will download from website, and I will send it to you in your the group. So you can keep it with you. You can download it yourself as well. What's the big idea? What's the big deal in that? Nothing. Like I said earlier, hurdle is what? Hurdle is you yourself. Okay, so don't take anything on your nerves. Okay, help is available. Okay, everything is there. Okay, things are going to be there. So I cannot promise anything now, because today is our only the session, that how you are going to start. Once you will start your session, things are going to be very easy. Okay, so don't the kind of think about breaks and the sessions and times and everything. Okay, we are not kindergarten students. Okay, we all are grown up students, doctors. All right, so increase your stamina. All right, increase your what I must say, patience, perseverance. Okay, consistency is a key to success. All right, consistency needs to be there. Consistency mean I have to study one guideline every day. Okay, I have to study the mini schedule topic. For example, I have to study this, but for the one or the other reason, I could not study. Doesn't matter. Don't cry. Don't complain. No problem. You had any problem? Maybe you were sick. Maybe you were, engaged somewhere. No problem. Okay. Try to cover it next day. Try to cover it next day. Okay. sweetheart, please hang on. Okay. Let the course start, and then we will see where we stand. Okay. I cannot promise anything because we are not into any online session at the moment. So this is just, the kind of, the orientation session. So try to take an orientation first. You guys really want to put every egg into almost, the every basket. Don't do that. Okay. Don't do that. So do take things, the slowly, get into the, the system first, then things are going to be easy. All right. So don't do that. If you haven't studied this, so cover it next day. No problem. All right. Cover it next day. All right. So, if you haven't covered this thing today, no problem. Cover it next day. Maybe my one day is completely off. So I can sit with myself and I can cover the whole topics. No problem. All right. No problem in that. Even, I think this is very unlikely, but still, if you haven't studied anything, no problem. You are meeting me in the online session. So be there, and try to listen to me. Okay. I'm a teacher, and you have to have a listening capacity as well. Okay. You have to have an absorbing capacity as well. Okay. So in part two, you need to give your 100%. Okay. We are going to help you and we are going to guide you what to focus on, what to study, which part of the guideline is important for single best answers, and which part to focus on extended match questions. Okay. Okay. So don't do that. Totally dependent on course. Like I said earlier, single best answers for part one is very easy. By the time you are entering into part one, almost 80% or 90% of you are already done with your board exams or your country exams. So you already have knowledge, isn't it? Isn't it? So part two is completely different. Please feel the difference. Okay? Please feel the difference and do try to absorb what I'm trying to convey and what I'm trying to tell you guys is. Okay? So don't worry about it. For example, from one session to the other session, you will have at least 5 to 6 days, the time to cover important, the topics. Even by any reason you didn't study, no problem. Don't be upset. Do try to attend online session. For example, if you haven't, the attended online session, don't worry. Again, don't cry. Don't be upset. Okay, because recording will be with you. Listen to the session as many times or whenever it is feasible. Okay, got it, Anjali?
Can I ask you one question, ma'am? Yes.
Mm-hmm.
Because in part one, I was totally dependent on Dr. Mahesh and
Mm-hmm.
the that exam, approach and the course and material, whatever. So
Mm-hmm.
in the part two, I
Mm-hmm.
can be totally dependent on you guys for all material and everything. For me, no need to dig from somewhere else or like that. Or
No, you have to follow what we are going to convey. Okay, guidance, first of all.
yes,
Okay,
yes,
first of all, need to understand the module. Okay, so we are
yes,
teachers. We know that for urogynecology, these are sources. So we will give you these sources. Okay, so first try to cover. If you do anything, okay, and if you have done any question, and one question is coming from I don't know which and which pool, so you can open. You have your website access. Open website and go through it. Okay,
yes.
so
Okay, ma'am.
things are going to be there, first thing. Okay, and secondly, of course, m- see, dependent means doesn't mean that I am going to go there at your place. Part two is extremely different from part one. Okay, so
Mhm.
please try to understand that part two is all about concept. Part two is all about thorough knowledge. Part two is all about thorough studies. Because in part one, I know nerve, the major nerve root, okay, and the its branches. I know the major vessel and its branches. That was very clear, okay. But now you will learn about all those branches. Oh, okay, this procedure, this nerve is cut. So what will happen? This procedure, this thing will cut. What will happen? Now this is clinical implication. Okay. So,
Okay,
so
ma'am.
this is what, and this is how you have to study. First, learn the difference between part one and part two. Okay, and then of course, and please give yourself time. Okay, this is just for your first day. Once you will enter into your mini schedule or everything, things are going to be with you. Okay, study them, discuss it with Dr. Rupam. Okay, in study group, be consistent and be vigilant. All right. And don't wait for anything, because things are going to be shared. So now this is your job. We are not in KG, the school. I'm not going to ask you, hey Nikita, did you study this? Hey Subra, did you study this? Hey Shmaila, did you study this? We are not going to take attendance from you every day, right? This is your job. Time is given to you, 2 p.m. Okay. Now this is your job, that you will come and you will study yourself if you really want to. All right, got my point? But yes, of course, if nobody is coming, nobody is showing up, so of course we will call them. But before that, this is your job. You have to come. All right, got my point? Hmm? So please feel the difference, extremely difference. How much experience is needed? No experience. Okay. Part 2 is all about theory. You can enter into part 2 right after your part 1. But for part 3, yes, you need 4 years experience. Okay. 4 years training or 4 years experience. That is going to be extremely different. We call it as assessment of training. Then you have to send your assessment of training program. At the moment, don't worry about anything. All right. RCOG doesn't need anything. RCOG needs you, your concepts. Okay. Your study. That's it. Okay. So please.
Excuse me, ma'am.
Mhm.
Sorry to interrupt you, ma'am. I need to ask something. Can I?
Mhm.
Ma'am, I have recently given my MRCG Part 1 exam. Why I joined my Med Exam Expert course for
Mhm.
MRCG Part 1.
Mhm.
I reside in Ireland and I'm not working at the moment for some
Mhm.
reason. But
Mhm.
sooner I will be joining my duty from July. So I just
Mhm.
wanted to ask, is this the right time to go for MRCOG Part 2, or should I join my job and then go for MRC2? Like I'm recently
No, job has
graduated.
nothing to do. Job has nothing to do with your job. The this exam. Okay?
Okay.
Yeah, job has nothing to do with your exam, because this is all theory. Okay? This is all
Like
theory.
I
Mhm.
mean to say, like I'm a fresh graduate, so that won't affect my planning or my learning. It's okay. Like I can go with MRCG Part
If you
2.
have
It's
done any house job, if you have
yes,
any
ma'am.
so I mean, I think it is okay. Because because if somebody doesn't know what a uterine or UV prolapse is, then yes, it is going to be trouble.
Okay.
But if you know where this prolapse is coming from, so I think it is okay.
Okay, so like job and years of experience doesn't matter for
No,
Part
no,
2.
it
If
doesn't matter.
okay,
Doesn't
okay,
matter. But you
okay.
have to have, at least, like I said, if somebody doesn't know anything about uterovaginal prolapse, so then it is going to be bad, isn't it? Then yes, you need, some clinical experience as well.
Okay, and ma'am, one more thing. Ma'am, I have just like joining this session since very start. I just saw your very first slide
Mhm,
where I saw that you also have done MRCOG, MRCPI,
mhm,
and everything.
mhm,
Do you
mhm.
think is should I go as I know that by giving MRCG Part 1, if I clear that, my MRCPI 1 will be exempted. So should I go for MRCPI 2 or MRCOG 2 right now? I'm residing in Ireland at the
Same.
moment.
Yes, 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 yes. I know what you are coming from, but sweetheart, one exam at one time. Okay?
Okay.
Yeah. So I mean, I won't talk much about it, but one exam at one time. You can't sail so many boats in one time, right? So because
Yes.
every exam has different, the perspective. Every exam has different syllabus, because many guidelines are extremely different from, the RCOG for Irish curriculum. So if you will go for, the Irish at the same time, so I think you will be confused, right? Because, like I said earlier, that brain has a capacity to retain, to reproduce everything. So if you will
Yes, ma'am, you're right.
stuff your brain with so many things, so please don't do that. Be easy on yourself too. Okay? With the passage of
Okay.
time, sure you will do it,
And
but give
and ma'am,
yourself.
like, should I go for the MRCG Part 2? Like, no need to go for MRCPI Part 2 now.
You can go, but sweetheart, MRCPI is going to be in September. Okay? So
Okay,
if you are
okay,
done with July exam, so August, September, then I think it's going to be tricky. 2 months are not enough. So give
okay,
yourself
okay,
time. You give yourself time. Okay?
okay.
So
And ma'am, what is the best approach to give first MRCPI 2 or MRCG Part 2? Like,
uh,
if you were in my case, what you would have done earlier, and definitely, like, you have 2 degrees, so you know better than everyone and anybody else.
Well, it all depends on, because MRCUG is accepted in Ireland as well as MRCPI, so it doesn't make any big difference. Okay, so for
Okay,
me, if I were at your place, I would definitely choose first MRCUG, because if
okay,
If by any reason, if I have to relocate, so MRCOG will help me, isn't it?
Yeah. Okay, ma'am. Thank you so much, ma'am. Thank you for all my
Welcome,
queries.
welcome.
Thank you, Jazakallah.
Okay, Sarah, I would suggest Sarah start over. Okay, if you are confident that you will pass part one, so I would not suggest to waste a single day. Okay, start from now on. Okay, study by the end of 3 months at least. When the time comes for your, the interest form, expression of interest form. Okay, by the time if you feel that you are not ready for this exam, okay, then oh, you have given part two, then prepare for part three. Join me. Join me in part three. Okay, what are you waiting for? Send me your number. Okay, yeah, don't wait for anything. Okay, uh sweetheart, no training, no job on the basis of MRCOG part 1 or part 2. You have to have at least MRCOG complete or PLAB. PLAB is a license exam. PLAB is not exam. Okay, PLAB is not any exam, trust me. Okay, PLAB is just license exam. All right, so don't count and don't compare PLAB with MRCOG. All right, to enter into UK, you have 2 or 3 routes. One is PLAB. PLAB is license exam. With PLAB, you will get junior level job, okay, house job, like you have done in in your own country. Okay, if you feel that you can start from junior level, go for PLAB. Don't give MRCOG then at the moment. Okay, if you really want to enter right away, first route is PLAB, second route is MRCOG. Okay, but not MRCOG part 1, part 2, part 3. And don't expect that you will be trainee right away and you will be consultant right away. No way. Okay, no way. You have to have complete MRCOG to get your GMC. GMC is General Medical Council registration, like for us, Pakistan PMDC, okay? Pakistan Medical and Dental Council. So first you have to register with them and then you can apply for jobs. Right, so this is a separate the thing, and which I'll be talking after part 2. But at the moment, don't compare PLAB with MRCOG. Okay, both routes are very different, both exams are very different, and of course scope and everything as well. For me, I would suggest, if you are the FCPS or MCPS or any the degree holder from your own country, I would suggest go for MRCOG. Don't demotivate yourself. Okay, don't demotivate for yourself. Yeah, that's good, Shruti. Then you can start. Okay. You can start. Trust grade is like, I mean, usual in our countries, like we do MO jobs, right? This is not a training post. Okay. So yeah, go for it. Go for it. Everybody has, like I said, everybody has different, the circumstances, right? Trust grade is a kind of, the normal MO job, or you can say the RMO job. Okay. So it doesn't matter. You will enter into system. So by the time you will finish your MRCOG part 2, part 3, so perhaps you will get your training as well. So this is good. All right. So PLAB is a license exam. MRCOG is membership exam of Royal College. With both route, you can enter into UK. All right. But don't compare both exam. Both are extremely and entirely different. All right. Clear, everyone? Any question? Any ambiguity? Afreen, Anam Al-Rikabi. Okay. Denise, Anjali. Minimum time required. Very good question. So I would suggest minimum time required, according to your circumstances. I think 4 to 5 months are more than enough for every candidate. Nobody can study for years. Okay? Nobody can study for years. So 4 to 5 months dedicated study. Okay? 4 to 5 months. MRCOG 3, what will the status in Canada? I don't know about Canada. I'm sorry. But I think Canada doesn't approve MRCOG. Okay. So either you have to go out, or maybe you have to look for. Okay. So far, I'm not, the 100% aware of. No result affect any exam, no percentage affect any exam. Or does it matter in MRCOG? Word pass or fail. Okay. Either you pass or either you fail. Don't flaunt your percentages here and there. On your MRCOG, the letter, it will just written that you are MRCOG. No percentage will affect any exam. Okay. No. Shahtaj, if you really want to see, sweetheart, your aim is quite clear. So you want to go for this, right? You want to go for part 2. Okay? So start from tomorrow. Why you have to wait? Okay? Tomorrow we will start our urogynecology module. So start from tomorrow. What are you waiting for? Until unless your aim are not clear, aims are not clear. I'm from Pakistan and I have FCPS 2 exam. Sweetheart, for this FCPS 2 and MRCOG 2, I think curriculum is same. Okay. FCPS 2 is all about single best answer. So we don't have separate books, so many books. So you have to ultimately you have to cover the same books which I have shown you earlier. All right. So you have to do them again and again. So I would not say that it is very different. Ah, yes, our all candidates do that. So why can't you do it? Hmm? Are you entirely different student or entirely different human being? Hmm? Like I said, you have to be on your toes in part 2. Okay? You have to be on your toes in part 2. All right? You don't need to waste a single day. You can't afford to wait a single moment or the anything. Because part 2 is, like I said, it's very dynamic, it's very vast, and you can see that syllabus is so huge, isn't it? So please be on your toes, stay focused, all right? And follow me, follow our guidance, what we are going to convey and tell you. Okay, we have got a lot of experience by now, all right? And I think so of course we have to tell you guys that okay, this is how we need to do. For website, the team will guide you, mid exam expert. Okay, Lucine, team will guide you. All right. What is your query, Sadia? What is your query? Eligibility? I am telling you, there is no eligibility for part 2. Okay. Part 2 eligibility is passing part 1 only. Okay. Assessment of training is for part 3. What is good time, June or December? Sweetheart, December is no exam. Okay. July and January. There are only 2 dates for now. All right. July or June. Either you go for July exam. Okay. Or either you go for January exam. I would not suggest because almost every candidate passed part 1. Okay, so I would not suggest to wait. All right, start over. All right, start over and just study, because if you will wait for your exam you will waste another month, and if you decide to go for July exam, I think that is going to be very challenging. Okay, that's going to be very challenging to cover whole syllabus. And of course you don't want to go for premature attempt, then you will have to wait for next January, January 2025. All right, all right, got my point, Sadia? So I would suggest, if you are quite clear about your exam, about your goals, about your idea about your own life, so go for exam. All right, all right, so don't wait. And again, I would suggest, this whole period of part 2 preparation is going to be very overwhelming. At times you will be so demotivated, so depressed. At times you will be so overwhelmed. At times you will be so good. All right, so this is very normal. This is very normal for every candidate who is coming for this exam. All right, you got my point? So please hang in there. Okay, stay strong, stay focused, try to follow our guidance. Okay, plus try to follow your own, the strength as well. All right, you have been through so many exams in your own life as well, isn't it? So do you think that this is your first exam? I'm sure no. Right, I'm sure no. So please do that. All right, please do that. Again, I would not sound to be so repetitive. Okay, so all you need to do is be consistent. Okay, very good, very good, proud of you. Proud of you. See, sweetheart, what my aim is, after today's session, if you are very clear about how to start, what to focus on, what to study, so I think I have conveyed my message. If you don't know what you have done so far, if you don't know anything after this session, and still you are trying to look for so many other, the introductory session, then this is my failure. Okay. So I'm sure you guys will make me proud, at least in this thing, that you will be clear on this thing, that what to focus on, isn't it? Yeah, thank you. That's my girl. Thank you, Lucine. Thank you so much. Okay. Main bulk, guidelines. All right. Guidelines and TOG articles. This is your main syllabus. And rest of the things are going to be there, of course. All right. Yeah, of course. Again, revise with me. Okay. And please repeat after me. All right. You have to study. You have to stay focused. You have to be persistent. You have to stay consistent. You have to study daily. All right. Got my point? Hmm? No, Hina, I would not suggest that wait for result and then start. Okay. Mm, because I have been teaching for part one 5 years. I know, the tempo, and I know the curriculum and everything about part one as well. Okay. So I would not suggest everybody to wait for result and then start. Okay. Uh, And Nikita, yes, at least initially, sweetheart, you have to give initially uh, 3 to 4 dedicated hours. See, for me, this is another approach. You can agree or disagree. Everybody has different routine and everything. I'm a morning person. Okay, you can ask me, Dr. Zaib, let's study at 4 o'clock in the morning. I'll be ready. I'm a morning person. Okay, but I can't study at night at all. I can, the sleep after sunset anytime. All right. So what I do is, because of course I work in a hospital as well, like everybody. All right. So what I do is I get up early in the morning, do my prayers and whatever. Okay. Have breakfast, coffee, everything. I will study for at least 2 to 3 hours in the morning because my brain cells are active. I'm very fresh. I will study. I will make my notes, everything. Then, they get ready for hospital or everything, my day to day activity. Then I will come back. Then whatever I have studied in the morning, I will try to revise it after doing, whatever my home chore or whatever. Okay. So I will give again 1 to 2 hour in the evening consistently. So what I will do is I will revise whatever I have studied in the morning. Plus I will try to do questions, like I have told you my strategy. This is what I do. So by the time it's 8 o'clock or 9 o'clock or 10 o'clock, I'm tired, I'm done with the day, I will sleep. Hmm? I will sleep, right? So this is my routine. This is what I have done throughout my life. And people who know me, the friends who know me, they know that Zaib is not going to be available after 11 o'clock at night. Maybe, hardly, yes. But most of the time she is not going to be available, right? Because I'm gone. Because I have to sleep. Okay? This is one practical strategy. So I think this you guys can follow as well if you're working. See, you have to come out of your you can say um comfort zone as well, isn't it? Like I said, part two is very, very dynamic and part two is very vast. Okay. So you have to come out of your comfort zone. You don't have to wait for me all the time. The Dr. Zaib will tell me this, then I will start my studying. See, look, you have been provided with sources, you have your mini schedule. All you need to do is study. I'm not going to take a daily attendance at 8 o'clock in the morning that who is present in the class. Right? This is not KG school. This is not KG, the something. Right? So please increase your stamina, increase your focus, sleep well, eat well, okay? Increase your capacity to sit on your ischial tuberosities, okay? So make sure that you are having the strong stamina, because stamina is going to work for this exam, because you have to study, you have to stay focused all the time. Because if I am given only these 2 to 3 hours to study, so I have to utilize these 2 to 3 hours effectively. Okay. So I will make sure that I'm not detract and I'm not, the looking at mobile all the time, or, the watching TV or anything which is distracting me. Okay. So you need to increase your stamina, your focus, your anything which is going to count for this exam. All right. Any question, guys? So with this positive note, I'm going to end my session that yes, we are going to study. We are going to stay focused. We are going to give our 100%. Say yes or no with me. We are going to give our 100%. Yes or no? We are going to study. Hmm?
Yes.
Very good.
Yes,
So we
yes.
are going to study on daily basis. Okay. Doesn't matter if I don't study, but I will try to give my 100%. Okay. Thank you, Afrin. Thank you, Lucine. Thank you so much. Okay. Ask me anything. Okay. I am from Karachi at the moment. Okay. Yeah. Try your best. Please be the best version of yourself. Okay. Please. Please. Like I said, part one, part two, part three, 365-degree turn. In every exam, you will see different dynamic. Okay. Different dynamic. All right. How do you join your course, sweetheart? You can send me your number or you can contact my exam team. Okay, they will guide you. And inshallah, as a teacher or as a mentor, I can assure you that you won't regret joining us at least, because we do try to fulfill our job properly, nicely, and we do try to be there with you in your tough times and in your hard times, because we have been students too. I have failed this exam once. Okay, I have passed this exam too. So what? Okay, so you can see that I know the first hand knowledge as well as teacher perspective as well. So inshallah we will try to give you guys proper good guidance. Okay, we will try to be there as well, and I hope with the passage of time, after one or two modules, you will love studying for part 2. Okay, once you will enter in maternal medicine with me, I will make sure that you love it. Okay, that's my promise. Any student who teaches, who try to, the learn maternal medicine with me, they really love, it. Okay. And for me, myself, I really, they become overwhelmed and excited when I teach maternal medicine, because I know that that is clinically important, that is theoretically important, that is important for exam as well. All right. So thank you so much, guys, for being attentive, for being, the. Thank you, Dr. Sugra. Inshallah, I will see you guys in the live session, hopefully. Okay, so be there, study, be consistent, be persistent, be a warrior, and have a feeling all the time that I have to do it and I will do it. Doesn't matter. And please write it down. Write it down on your notebook in the start. If Dr. Zaib can pass part 2, certainly I can also part 2. Okay? You are no less than me. Okay? Nobody is less than anyone. Circumstances can be different. Things can be different. But it doesn't mean that, you are a bad candidate or I am a good candidate. Okay? Inshallah, I will see you guys. Okay. I will see you guys in the live sessions, but I will be with you in the study group as well. And session recording is going to be available, sweetheart. So I think it will be available after like few hours. All right. So don't worry about it. So by the end, write it down, write it down. I'm giving you permission as a teacher. If Dr. Zaib can pass part 2, can become a MRCOG, I can also become a MRCOG. All right. So see you guys, inshallah, in live sessions. Take good care of yourself, sleep well, eat well, study well, and don't detract. Okay? Don't get detract at all. All right? Allah Hafiz. Bye bye. Good night.